Then we were sent, Ravindra will tell you, we were sent to many places like Manipur, MMC and CMC to collect documents. That is the time, I tell you, there was no smartphone, no internet, no, you can't search. So we were sent to the various schools to collect, take xerox of the articles and write the dissertation when we were PT students. So now that you need the content, that time, why I wrote the book in 2001. 2001 the mobile phones came. Now, that is the time we used to learn to do an extraction. We used to have 5-6 books, small books, Jeffrey, Go, multiple books. So you need a good book which will match. Suppose you go for a Viva, the examiner is from Tamil Nadu, he will have a different thinking, he will ask you a different question. Suppose the examiner comes from Karnataka, he will have a different mindset. Somebody comes from Delhi, will have imagine an examiner comes from Royal College. He will have a different mindset. So you need a book, a contemporary book, which will answer all your questions. So me and Dr. Ravindran, we learned from different books. So now we need a book which will guide you. See, a book, if you see my green book, that is for postgraduates. The other book which I presented for textbook for your exam point of view. So I started thinking in that terms. I was going through my friend Dr. Tamil Chelvan. I have worked with him for a long time. When I was the IDA president, he was with me. When me and Rangarajan was. And he's a great academician, very good academician. He's very good organizer, especially IDA and the FDA. We created the Guinness record. I know he will create a Guinness record with all of you. One subject, I don't like to read some papers. One subject, lupus erythematosus, Pemphigus vulgaris, lichen planus, oral manifestations of dental diseases. And it's very tough. Don't laugh. He's, see, your surgery, TM joint surgery, you love to read. Your orthodontic surgery, this is how the face, now why we changed it this way. You're happy to see the book. But this, you have to learn it. You have to read. It is very tough. Well done. Now we come to the book, my first edition. And another important thing is, I told you the examiners are different. Okay. Now we need the foreword from world-renowned site. So we used to learn from Laskin's book. Laskin's volume 1 and volume 2. Yes. Okay. So I had the attendance of Professor Daniel Laskin, who's no more now. So he wrote the foreword. So when somebody takes your book and sees, okay, foreword by Laskin, then okay. Everybody will have a lot of ambition. Suppose take the cleft lip surgery, or first I mentioned about Professor Giri. See, when you operate on a 23-year-old girl, young girl, you want to change the face, you need to be extremely careful. Suppose you take a cancer case. Okay, face shield is already 70 years. Okay, now when you check the creatinine is a little bit high. Now then you need your ICU has to be good. Because you need a nephrologist. Imagine you are giving 2-3 units of blood. Something goes wrong to the kidney. Then post-operatively, already bilateral neck dissection, you would have done the Yulankumaran would have done the tracheostomy. Now you need a pulmonologist because it can go for a pneumonia. Long-term tracheostomy can get infected. Okay, come to that point. Now he's 70 years old. Now you send the patient for treatment. You send the patient for treatment, there is his Now you need a cardiology manager. Your anesthesiologist says prolonged surgery, 8 to 10 hours surgery is difficult to handle. So, neck dissection. Now Giri is sending it. Yulankumaran sending. He's saying that level 1B is positive. Now he's saying, no, I will check the level 1A also. He is sending it for the frozen section. Okay.